At the clinic, bitch bays are usually a one-day procedure, and someone will give you a call the night before to arrange a time for you to come in on the morning of the surgery. In the morning, you'll have an appointment with the nurse, and she'll do a little check over of your dog and ask you some questions to make sure that she's okay for the surgery that day, and to go through and make sure you're aware of everything that's involved in the procedure. They'll then be settled into our dedicated dog ward before receiving an injection. This injection is what we call a pre-med, and it contains a pain relief and a sedative to make the anaesthetic go much more smoothly. Once that pre-med's taken effect, you can see that they're quite sleepy and much easier to work with, and at this point we'll place a catheter. This allows us to give drugs and also fluids throughout the surgery. They're then induced and a tube is placed to maintain the airway. Throughout the procedure, updates will be posted to your timeline so you can monitor from at home. The area is then clipped and sterilised, or as best as we can, with a disinfectant. This disinfectant we use here is blue and maintains for a couple of days, so don't be surprised if your dog stays blue for a little while. The surgery then takes place in our operating theatre and takes between 20 minutes and an hour and 20 minutes depending on the size of your dog and how fat they are. Throughout that time they'll be monitored both by our anaesthetic machines and our qualified veterinary nurses. Once the surgery is finished, a bandage is placed over the site to protect it from infection, and they're allowed to recover. At this point you'll receive a phone call to arrange a discharge time, although you will be able to keep up to date with their progress online. When you return to the clinic, you'll have a discharge appointment with the nurse who'll go through all the post-op instructions and the medication before reuniting you with your pet. At this point, a 2-day and a 10-day check will be booked to make sure things are healing correctly. You'll also receive a phone call 24 hours after the surgery to check that everything is progressing as we expect. At the 10-day point, stitches will be removed unless buried internal sutures have been used. This is quite a simple procedure, it doesn't take too long, and once we've removed all the sutures, we'll consider the dog to be back to normal, and everything should be pretty much fully healed, and they can go back to their usual life as a dog.